Hi, my name is Novelene Martin. I'm the Bureau Chief for the Montana Developmental Disabilities Program, which is part of the Montana Department of Public Health and Human Services. I'm going to do an overview of the changes that will be happening to our children's autism waiver.
What is the difference between Medicaid and a Medicaid waiver?
There is a difference between state plan Medicaid services and a Medicaid waiver. State plan Medicaid determines eligibility using the family income. They serve all eligible members. Individual services have medical necessity criteria. They must serve the entire state, and they cannot limit the number of members. Medicaid waivers will waive family income, counting the individual as a family of one for income purposes. Medicaid waivers can have a waiting list. Individuals in the waiver must meet an institutional level of care. Medicaid waivers limit enrollment, and the waiver must be the payer of last resort, paying after Medicaid, state plan services, or private insurance.
What is the Children's Autism Waiver?
The Children's Autism Waiver serves 55 children between the ages of 18 months and 8 years of age. The children enrolled in the waiver receive 3 consecutive years of service. Services are provided to children throughout the state in their family home. The currently approved waiver expires December 31st, 2016. However, the Developmental Disabilities Program has submitted a renewal for the Children's Autism Waiver to the Centers for Medicare and Medicaid Services, also known as CMS. The waiver can be found on the Developmental Disabilities Program website.
What is currently happening with the Children's Autism Waiver?
The Children's Autism Waiver has been submitted for a 3-year renewal to the Centers for Medicare and Medicaid Services, also known as CMS. The proposed renewal will phase out the waiver. No selections for the waiver will occur during the course of the 3-year phase-out. For those children in the waiver, the child will continue to receive services as described in the waiver for the length of their 3-year enrollment. The renewal is compliant with CMS Guidance on autism services.
What are the service changes to the waiver?
There are a number of changes to the waiver. There's a proposed limit on waiver children's case management. This limit was implemented to comply with CMS's conflict-free case management ruling. Program design and monitoring and children's autism trainer will remain in the waiver pending approval of the state plan services for autism. Respite, individual goods and services, environmental modifications, and transportation will not change. Extended state plan services of physical therapy, occupational therapy, and speech therapy will be removed from the waiver. Members can access the services through the state Medicaid plan.
When is the Children's Autism Waiver ending?
The Children's Autism Waiver renewal is proposed to end December 31st, 2019. Members will be exited from the waiver upon completion of the 3 years of service. No children will be selected for new waiver enrollment.
How will families be informed of changes in the waiver?
The Developmental Disabilities Program has sent a letter to the guardians of all children currently enrolled in the waiver. The same letter was sent to the guardians of the children on the waiting list. The letter outlined the anticipated changes in the waiver. Contact information was included in the letter for families who have questions.
How will children receive assistance in transitioning to other services?
Children currently receiving waiver services are transitioned from the waiver after 3 consecutive years of service. The waiver children's case manager develops an individualized family education plan annually. This plan describes the activities which will take place to assist the family and child in their transition. The Developmental Disabilities Program would expect the waiver children's case manager to work with each individual child and family to identify their unique needs and formulate a plan to meet those needs.
What was the CMS Guidance?
The Centers for Medicare and Medicaid Services issued guidance on July 7, 2014 around autism services. In that guidance, they indicated that treatment for children with autism spectrum disorder can improve physical and mental development. The federal Medicaid program may reimburse for services to address autism spectrum disorder through a variety of authorities. These authorities are different parts of a Medicaid state plan. Ultimately, the goal of early periodic screening, diagnosis, and treatment, also known as EBSTAT, is to assure that children get the health care they need when they need it, the right care to the right child at the right time in the right setting. The role of states is to make sure all covered services are available, as well as to assure that families of enrolled children, including children with autism spectrum disorder, are aware of and have access to a broad range of services to meet the individual child's needs.
What state plan Medicaid services will be available to children once the waiver is phased out?
The state is working with the Centers for Medicare and Medicaid Services to gain approval of the Autism State Plan Amendment. The services include conflict-free diagnosis for all children who have autism or autism-like symptoms, evidence-based interventions provided where the child lives, receives care, and attends school, autism implementation training for parents and other caregivers. Other Medicaid services continue to be available to children if they meet the medical necessity criteria.
What are the early intervention services available to children?
There are a number of services available to children that can replace the Children's Autism Waiver. Upon approval of the Autism State Plan, children eligible for Medicaid may be eligible to receive state plan services. Children with private insurance need to contact their insurance provider. Montana Milestones Part C early intervention services are available to children birth to age 3. Public education Part B special education services are available to children ages 3 and older. Other Medicaid services may also be available, such as physical therapy, occupational therapy, and speech therapy. Where do people go if they have questions? Please contact Carla Remy, our Medicaid Program Officer, at 406-444-6047, or email Carla at crime2@mt.gov.